I'm Dr. Rob Hunter from Salida, Colorado, and I'm going to show you today how to use the spider and the lateral jack to do shoulder surgery in a lateral decubitus position. We put the patient on the table first. We position them in a lateral decubitus using a bean bag so they're perfectly vertical. The first thing that we install is the spider, and I position the spider such that the spider is in the distal third of the thigh. So I'll find the patella, I'll find the distal thigh, and I'll arrange the spider and attach it on the same side that I'm going to be operating on at the distal thigh. We position it such that when we're going to prep, if we put it vertical like this, it's out of our way so that we can prep the shoulder, we can drape the shoulder, and the spider is not interfering with our ability to do that. We also pre-position the lateral jack. That's on the opposite side of the shoulder we're going to operate on. It's angled so that when I swing it down, I can place it just distal to the axilla. This pad allows me to rotate the lateral jack so it's not applying pressure into the upper arm, and allows me to position it such that when the time is appropriate, I can elevate the humeral head away from the glenoid in order to do interarticular reconstructive procedures, particularly in anterior Bankart repair. So once I've positioned that, I can push it back out of my way. And the nice thing about having it on the contralateral side is that I can rotate it out of the field. It's completely out of my way. It allows me to work front and back. Once we have the patient positioned, prepped, and draped, then we have to prepare the spider for the surgery itself. We'll first attach the connector, which comes sterile. And that simply pushes in as long as this key lock is down to accept it. If that's up in the lock position, this won't go in. If it's down in the unlock position, you can insert that and then lock it, and you're good to go. And once that's in place, you can install the sterile bag. And the sterile bag simply slides over the top. By grasping the bag, you can install it and effectively drape away the entire spider. And then just by delivering the tip of the connector through the end of the bag, you can create a sterile connector between the spider and the other device. We'll attach the device and lock that in place so it doesn't come off. And then I'll rotate this so that I can attach the arm attachment directly to this so that I can put her arm on the attachment. This connects next, and you can adjust this if you connect it and it's rotated out of position for her hand by unlatching the rotational lock. You can place the arm holder where you want it to be, and I put it horizontal so I can put her arm in it and position it as I wish. One of the real advantages of the spider is its ability to control rotation, internal and external rotation of the shoulder, and I use that in two specific situations frequently. Number one is if I'm trying to position the greater tuberosity underneath my portal for a rotator cuff repair. And number two, if I'm doing a biceps tenodesis and I want to deliver the bicipital groove to my portal or to my incision, if you prefer to do it as a small open procedure. And to do that, you just have to unlock the spider using this locking clamp up top. Once it's unlocked, I have the ability to easily and freely rotate the humeral head. I can rotate it where I want to go. For example, if I'm doing a rotator cuff repair more posterior over the infraspinatus, I would internally rotate the arm to deliver the posterior aspect of the greater tuberosity. Then I can lock that down, and it completely locks the rotation where I wish it to be. If I'm doing more anterior work on the tuberosity, I can unlock it and externally rotate the arm and hold it there and lock it in place, and I have effectively externally rotated so I can get to the greater tuberosity, or oftentimes the bicipital groove requires a little bit of external rotation. In addition to the rotational capacity, the other aspect of this that's very nice is the ability to control traction. So I can unlock and I can pull harder. If I need to distract the humeral head, I can take the pressure off if I want to take less distraction force. So I can control it quite nicely just by virtue of positioning it in space and releasing the pedal in order to get the kind of distraction and rotation that I wish. When I'm doing a rotator cuff or subacromial work, having the spider in this position works very well, because as you apply traction, you notice that you're going to pull the humeral head a little bit lateral because of the vector that's pulling it in an abducted position. But mostly, you're pulling the head inferior, which opens up the subacromial space. But if you're going to do glenohumeral work, if you're going to do a reconstruction, you really don't want to pull the humeral head inferior. You want to pull the humeral head lateral. You want to lift it up away from the glenoid. So if I'm going to do a Bankart type reconstruction where I need more visualization in the interarticular space, I will take the spider and take pressure off so that I'm not unduly pulling and subluxing the shoulder inferior. I'll take pressure off and I'll adduct it just a little bit so that I have kind of a neutral position at the glenohumeral joint. Then I'll rotate in the lateral jack, which I've pre-positioned. There's a little lever right here that allows you to lift it up and push it down. And when that's released, it locks in that place. So I'll rotate this lateral jack into position so that I have it underneath her upper arm. This rotates so that it takes the pressure off of the neurovascular structures in the upper arm. And once I have it where I want it to go, then I can lift the humeral head just by releasing the lever. And what that does is to draw the humeral head lateral out of the glenoid so that I can visualize and pass through the glenohumeral joint without applying any kind of distraction force with the spider itself. And once I'm done, and I've done my work, I can easily take the pressure off so that I'm no longer putting pressure on the axillary structures. And I can rotate this up out of the way so that once I've done all my interarticular work, this is now out of my field. I can work front and back without any trouble. Now, if I'm doing a Bankart reconstruction, I can insert this where I want it to go. I can elevate the arm so that I'm now pulling the glenoid out. And the beauty of this is it's very low profile. So that in position where it is now, I can very easily work through the front of the shoulder. I can work in the back of the shoulder. I can work my cannulas very effectively. And there's nothing here that gets in my way. It's completely below where my portals are. So I can work front to back. I can work back to front. And this is not any obstruction to that kind of work. Once done, rotate it out, and you're safe. I think the beauty of this is you can put it in when you need it, you can elevate the head, and when you're done, you can put it down and rotate it away so you have minimal amount of time of pressure on the neurovascular structures in the upper arm, and yet it gives you a tremendous option to elevate the head and see what you need to do.